Georgia medical malpractice and personal injury lawyer. I want to talk to you briefly today about a case that I handled involving a local hospital. A gentleman of around 50 years of age got into an accident, and as a result, he ruptured his spleen and broke a bone in his leg. He was taken to the hospital and underwent surgery. Following surgery, he was admitted to the intensive care unit, ICU. During the period of time that he was recovering, because his recovery was prolonged, he developed respiratory problems, breathing issues, and had to have a breathing tube put in. As a result of agitation that he was experiencing, probably from this prolonged hospitalization, possibly as the result of the many medications that he was receiving, he, in an agitated state, pulled out his breathing tube. As a result of pulling out the breathing tube and also associated leads that were there for monitoring, alarms were supposed to sound in his room and also remotely in the nurse's station. And nurses are supposed to listen to those alarms and respond immediately. That is required by standard of care. Unfortunately, for some reason, no one responded to the alarms when they were sounding. In fact, another nurse that was not assigned to this patient happened to be walking down the hall and looked into the room and happened to see this gentleman slumped over the end of his bed. She called out, she got a resuscitation team there, and when they looked at him and examined him as they were about to begin resuscitation, they noted that he was blue and mottled literally from the rib cage up, indicating that he had been without air, been without oxygen for several minutes. Resuscitation was unsuccessful, and unfortunately this man died. Hospitals, especially intensive care units, have a duty to monitor carefully. They have a duty to make sure that that the alarms that they have are audible in the patient's room, in the hallway, and also at the nurse's station. They also have a duty to make sure that their nurses respond in an immediate fashion to any sounding alarms. A sounding alarm, particularly in ICU, is a potential emergency. We were able to successfully resolve this case and hold the hospital accountable under these circumstances for the benefit of this unfortunate widow. Thanks for listening.